Have you ever wondered why heart attacks are one of the leading causes of death worldwide? It's a question that may have crossed your mind as you've heard about the silent killer that doesn't discriminate. It can strike anyone, anywhere, at any time. And it's this unpredictability that makes heart attacks a global concern. Despite our advances in medicine and technology, heart attacks remain a formidable opponent. They're a stealthy adversary, often creeping up unannounced and leaving devastation in their wake. And while they may be silent, they're far from invisible. The key to combating this silent killer is early detection. It's our most powerful weapon. The sooner a heart attack is detected, the more likely it is that the person will survive. It's a simple equation, yet one that can mean the difference between life and death. But how can you detect a heart attack early? Let's dive into this. Beware of the silent signs. They might be a ticking time bomb inside you. Now, let's delve into the warning signs of a heart attack. The most common symptoms are often mistaken for less serious conditions, which can be a dangerous oversight. Firstly, chest pain or discomfort is one of the most recognizable symptoms. This isn't always a dramatic clutch your chest kind of pain. It can feel like pressure or squeezing, and it might even come and go. Then we have shortness of breath. You could be sitting still, not doing anything strenuous, and find yourself struggling to catch your breath. This can occur with or without chest discomfort. Thirdly, nausea can be a sign. You might feel sick to your stomach, vomit, or have a bout of intense heartburn. Lightheadedness is another warning sign. You could suddenly feel dizzy or like you're going to faint. This can be due to a drop in blood pressure as your heart struggles to pump blood effectively. Lastly, breaking out in a cold sweat for no apparent reason is another symptom that should not be overlooked. It's not your average sweat from exercise or anxiety. It's more like stress-related perspiration, often described as a cold sweat. These symptoms can be varying in intensity. Some people experience severe discomfort while others feel merely a slight inconvenience. And here's the scary part. Some heart attacks are silent, meaning they occur without any apparent symptoms. So how do you distinguish between a common ache and a potential heart attack? It's all about the context. If these symptoms are new or they feel different from anything you've experienced before, or if they're accompanied by other symptoms on this list, it's time to seek medical help. Remember, these are just the most common symptoms. Heart attacks can present in many different ways, and the symptoms can be different for men and women, and they may even vary from one heart attack to another in the same person. Recognizing these signs can be the difference between life and death. Don't second guess. Don't brush it off as nothing. Your heart is your life's engine, and it's crucial to keep it running smoothly. Scene script. Time is of the essence when the heart is under attack. When it comes to a heart attack, immediate action is not just important, it is crucial. Recognizing the symptoms of a heart attack is only the first step. What you do next, the actions you take in those critical moments, can mean the difference between life and death. Imagine this: you've identified the warning signs, the sudden chest pain, the shortness of breath, the unexpected lightheadedness, the nausea, and that cold, clammy sweat. The alarm bells are ringing in your mind, and you know something is seriously wrong. So what's next? The first thing, and perhaps the most vital, is to call for emergency services immediately. Don't hesitate, don't second guess, and certainly don't try to drive yourself to the hospital. Time is ticking and every minute counts. While waiting for help to arrive, try to stay as calm as possible. Yes, it's easier said than done, but remember, panic can exacerbate symptoms and make the situation worse. If you have aspirin at hand and it's not contraindicated for your health, taking one could potentially help. But this should only be done if advised by a healthcare professional. Aspirin can help to thin the blood and may prevent further clotting in the coronary artery, which is often the cause of a heart attack. While waiting for the paramedics, it's crucial to keep your mind as calm as possible. Try not to move too much and exert yourself, as this could put further strain on your heart. The key to surviving a heart attack is immediate action. Recognizing the symptoms and calling for help without delay can increase your chances of survival significantly. It's not just about knowing the signs, but also knowing what to do when they present themselves. Remember, every second counts when it comes to surviving a heart attack. So be vigilant, be prepared, and most importantly, don't waste time when your heart sends out distress signals.